Hello, everyone, and welcome to another 2 minute segment with IRDOC Nigeria. Today, we're going to be talking about a disease called venous insufficiency disease. But first of all, let's go through the anatomy of the veins in the legs. The veins in the leg comprise of both the deep veins and the superficial veins. The deep veins are the veins that are close to the muscle or very close to the bone and deep within the leg, while the superficial veins are just under the skin. Both veins have the function of carrying blood back to the heart in one direction. You start to have disease in the veins when blood goes back in the other direction. For example, in venous insufficiency disease, blood starts to go back from the deep veins into the superficial veins, and this is caused by damage to the valves in the veins. So essentially, when the blood is pumped forward, these valves are supposed to close. However, in patients with venous insufficiency disease, these valves remain open and blood is able to come back into the leg to cause a condition called venous hypertension or venous insufficiency disease. This is manifested by symptoms such as varicose veins, spider veins, or when it gets worse, it could be as bad as swelling in the leg or discoloration in the leg. The patients that have the worst disease, called C6 disease, have ulcerations in the legs. The important thing is you want to present to medical care very early when you have an ulcer in your leg or when you have leg swelling, because if you do not present early enough, you could end up with progression of the disease from a small ulcer like this to a fragrant infection in the leg, which is very difficult to treat. So what can you do to manage your symptoms? When you have mild symptoms such as leg swelling or varicose veins, you could elevate your leg or wear compression stockings. However, if symptoms get worse, like when you have leg swelling, when you have visible varicose veins that are bad or darkening of the skin, you might have to have a procedure called venous ablation. In this procedure, it's an outpatient procedure where we go into that vein that's abnormal, the superficial vein that's abnormal, and we basically burn that vein and get rid of it. And with doing that, we could deal with the pathophysiology of the disease or the etiology of the disease and decrease the chances that your symptoms will come back.